Hey everyone, today we're tackling a literal hidden nightmare lurking in almost every single home, caustic ingestion. We're talking about everyday household chemicals that can cause unimaginable damage to the human body in a matter of seconds. We've absolutely got to understand this threat and know how to act fast, so let's get right to it.
What even are caustic substances? Well, they're basically everyday chemicals powerful enough to burn and deeply destroy human tissue the second they make contact or get swallowed. We aren't talking about a mild rash here, guys. This is immediate, severe destruction that absolutely requires urgent medical care. Okay, let's dive into this. The damage basically falls into two horrifying categories. Acids cause what we call coagulation necrosis. That means they burn and harden the tissue, creating superficial injuries and bringing a massive risk of severe scarring in the esophagus. On the flip side, alkalis or lyes cause liquefactive necrosis. The tissue essentially melts. This allows the chemical to penetrate incredibly deeply, which risks massive stomach and airway perforation. It's really serious stuff. And here is the truly scary part. These common culprits are probably sitting beneath your kitchen or bathroom sink right now. For acids, think heavy-duty drain and toilet cleaners, battery acid, and concentrated vinegar. Alkalis, you'll find those in oven cleaners, washing powders, and bleach. And we totally can't forget other toxic agents like standard detergents, disinfectants, and phenols. They are literally everywhere. Number 2, spotting the symptoms. The damage from these chemicals progresses so rapidly. Within just minutes of ingestion, you'll see drooling, difficulty swallowing, and severe pain in the mouth, throat, or chest. Then, as the hours pass, the symptoms shift to nausea, vomiting, coughing, and hoarseness as the airway gets affected. If left untreated, days later, the late-stage complications emerge. We're talking severe abdominal pain, high fever, struggling to breathe, vomiting blood, and even shock. In these situations, time is tissue. Section 3. Critical first aid measures. So the crucial point is this step-by-step pre-hospital survival guide. First, ensure safety, check for responsiveness, and call emergency services immediately. If the person is conscious, have them gently rinse their mouth and spit. Never, ever swallow. Remove any contaminated clothing and get to the hospital immediately. Why? Because at the hospital, they're going to require urgent management, things like endoscopies to assess deep burns, breathing support, or even immediate surgery to repair perforations. Don't wait around. Section 4. Deadly mistakes to avoid. Now, what's really interesting about this slide is how many common sense reactions are actually totally wrong. First off, absolutely do not induce vomiting. This literally forces the chemical back up, doubling the damage to the esophagus. Second, no drinks. Giving milk or water can cause choking or just worsen the injury. Third, never try to neutralize the chemical. Mixing acid with alkali creates a thermal reaction, literally burning them further from the inside out. Finally, no food and no unprescribed painkillers. Just don't do it. Having a visual cheat sheet, like my comprehensive emergency action plan here, is a total game changer. It ensures early recognition and prompt medical care. Honestly, it's a critical resource to just keep on your fridge or on your phone to guide you through these incredibly chaotic moments. And finally, prevention is the only cure. Protecting your family really means making your home a fortress against accidental poisonings. Store all caustic substances in locked cabinets, completely out of reach. Always keep chemicals in their original, clearly labeled containers. Never, and I mean never, transfer these dangerous chemicals into beverage bottles or food containers. It's a recipe for disaster. And of course, actively educate your kids about the dangers and supervise them closely. So, I want to leave you with one final urgent question. Are your cleaning supplies truly out of reach and locked away securely right now?